Hello and welcome to the special edition COVID-19 Rogers TV program. My name is Carol Merton, and I'm delighted to welcome as a guest Gary Sims. And Gary is the President and Chief Executive Officer of Grey Bruce Health Services. Gary, thank you for joining us, and I trust that's the same title. I have found in COVID-19, everyone keeps changing titles. Have I got it right?
Mine is just the same as it always has been, yeah.
Thank you for being with us today, Gary. I know you're a very busy gentleman. My first question to you, before we get into the list of questions that we shared, how are you and how are the staff coping? Well, there's great concern out here in our community for our healthcare service providers.
Well, I think thank you for having me here today, and thank you for giving me the opportunity to speak. But what I would say, I guess, first is the staff have worked so hard for so long, and I know that everyone in the community is tired of COVID, as we are too. But you know, the staff continue to work regardless of the circumstances, and to their credit, they serve their community proudly. And but they're tired. There's just no doubt about it. Before we were very, very busy. Before COVID, we were very stretched and very busy, and people knew that, and always changing the environment of healthcare. And having gone through the last 2 years, and it has been 2 years now, my staff are tired. So, you know, we're working hard to get through this wave, and certainly our hope that in the near future, we're moving this from pandemic to endemic, and we can get back to normality, which I think is what everybody wants.
Yeah. And I agree. You know, I was looking up the names of the speakers and just getting the different pictures, you know, just to get the titles. I can see a difference in not in everyone, quite honestly. So together, you and I will be as perky as we can be and answer these questions, Gary.
Absolutely.
But I just want you to know that we are concerned for you and the providers, and we're very grateful for everything that, you know, Grey Bruce Health Services and all of the other providers are doing for us in the community. So thank you.
Thank you.
So tell us how things are currently going with Grey Bruce Health Services.
Well, as a service, we're doing well. I mean, I think the positive parts are the Markdale build is still going very well. Our extra new ambulances have arrived for our non-urgent transfer service. We're happy about that. Our new staff parking lot went in. Our new cataract suite in Meaford is almost complete now. So we're on the verge of strategic planning starting in February, which will lead us to grand planning. And that's all an extension of the clinical planning we've been doing for the last couple of years. So we're pretty excited about those pieces. From the COVID side, which I know people are interested in. We were busy. We were not busy in wave 1 and wave 2. Wave 3, we were very busy. And wave 4, we've been very busy. You know, we've shut down our surgeries to urgent, emergent only, and focused on cancer and urgent. The reality for us, though, is we have seen the highest amount of patients in this wave than any wave before. Right now, we have 13 active patients in the hospital that are COVID patients. Unfortunately, 3 deaths in the last 2 weeks, 1 just yesterday. We do still have 4 people in critical care. 2 of them are vented. It's, you know, we're running at an occupancy of over 100% for mental health, 100% in medicine, 90% in rehab. Our Markdale hospital is at 100% and has been for a while now. We just came out of an outbreak on our medical floor. We cleared that. And then unfortunately, this week we went into an outbreak in the Wyerton site. Southampton's running at 90%. We have some staff being sick on a regular basis because of Omicron is such a virulent form. The reality of that is we see about 24 additional staff members per day off. And we've had that pretty steady now for about a month. The numbers are decreasing. It was as high as almost 40 at one point. So we are seeing it level out right now to 2024, which is good news. But because of our occupancy, you can tell we're still stretched pretty thin.
Wow. So two things around this. So even in the middle of COVID, you've continued to expand and grow and change service, which is remarkable in itself. And then on the other side, with decreased staffing and increased demand, you're still providing the services. That is truly remarkable, Gary. Really. I'm interested about the urgent or emergent situations and the fact that you're still addressing those patients with cancer. Is this unusual in because you hear in other places those awaiting care are awaiting care? How did you decide to do the cancer care? How did that evolve? I mean, it's great that you're doing that, but how did that come to be?
Well, almost by accident, because most of the time the pressures that are on the surgical services are always having to be balanced between the different services. Urology versus gynecology versus cancer versus orthopedics. You can see how that would work, and how each patient's demands are different, but all important, right? In this case, where you shut down most surgeries, you take away the pressures that now allow more urgent cancer patients, which have been waiting for a while. Now there's the catch-22. They got held in waves 1 and 2, and so have been allowed to flow a little bit easier now because it become more urgent. And so we're seeing more cancer surgeries being done. Certainly more oncology services are being done, about a 50% increase over the previous year. So we're still trying to do our best to address the cancer pressures, recognizing that coming out of COVID, there will be a surge is the right word. There'll be a surge on the backlog of all surgeries. So we will have to catch up on everything. And, so we're going to move out of this busy period of restrictions into a period where we're trying to catch up. So a very tired staff is going to be asked to overperform again for the next 2 years to catch up on the backlog, which is so important to people that are waiting.
Right. You mentioned about the occupancy, and the numbers you raise are extremely high because it's consistently high, correct? Hospitals can adapt well to maybe the ebbs and flows of occupancy, but you're consistently high. So the opportunity to draw staff from one area to another area may be a little bit reduced. Am I interpreting that correctly?
Yeah, in the fourth wave, well, I will tell you, a year ago, we knew we were going to be tight. And so we had offered to do 20 additional beds. So the percentages I'm quoting you are if you use our normal bed count numbers, because we've taken on 20 extra beds now. So when I quote you at 100% or 90%, that's including 20 additional beds we added. So in fact, we're way over 100%, even though we're doing it with the staff we have. And so understanding that once you close down urgent, emergent surgeries, you have some freed up staff. But frankly, with 24 to 25 staff off and then the extra beds, we actually have very little ability to stretch our staff any further.
Yeah. So you really don't have much of a buffer room around staff availability, for sure, and we know what happens when people get tired and stressed over time. So, it is a concern. With that 20 additional beds, I mean, that actually does speak to how busy the hospital is because it's above the 100%. How did you manage to staff 20 additional beds in a time when we're hearing more and more about nursing shortages and support staff shortages and, of course, physician shortages?
So one of the things that this hospital structure has to its advantage is that it's multi-site. And so the capacity to add a couple of beds here, a couple of beds there, 4 beds here, 6 beds there, what it does is it means you can adjust your staffing model a little bit to stretch a little bit, but you're asking it to stretch in multiple locations. And when you do that, it adds up to 20 beds. It's not one location, 20 beds. So it is one of the distinct advantages we've always had. We obviously have the challenges that go with that, which means we have 6 emerges. We have 6 labs, 6 of everything. But the advantage of the pandemic is we're flexible. We sometimes have to close this service, move it over here. If we can't keep beds open in one spot, we'll open them up in another, so we don't lose beds, but we're moving them around. And I think of Markdale as a perfect example. The Markdale Hospital had some staffing challenges, some people that went off purely nothing to do with COVID, accidents, injuries, etc., outside the hospital, but resulted in us having to close some beds. We were able to move those beds to a different location, but that means Markdale runs at 100% all the time now. And so anything that comes into Emerge now has to be moved, if it has to be admitted, to another site. And we're fortunate to be able to do that. And it's a credit to our physicians, to our staff, to our management, who work diligently to try to manage this. And I know for some patients, this is extremely distressing because you're saying to them, look, I need to admit you, but you can't go into your local hospital because I just don't have the beds. But that's the state of life right now.
Yeah.
And it's how we cope.
And certainly families and the community, we know it's better for people to have care closer to home and obviously supported. But how are you finding families and the community when you have to move patients? What's the feedback?
Yeah, it's a challenge. Everyone's circumstance is so personal and it's so close to home and their heart at the time that it's obviously disturbing. And so we have a great staff that try to work with people to work through the difficulties. I will tell you, one of the greatest pressures we face certainly is alternate level of care. That's the people mostly that are waiting for long-term care. And long-term care has had its own crisis throughout this. I'm sure you've witnessed it in wave 1 and 2, and then we saw all the deaths. And so they've had a real hard time. I think we have, I can't remember how many homes are out right now, 11 homes or something like that are in outbreak, so they cannot admit patients. And in the system across Ontario, we're sitting with almost 5,000 ALC patients sitting in acute care. We've never had that kind of number before. And those numbers reflect the amount of acute care beds that are taken up by people waiting to be in the right location. And we're challenged to, should we move those patients out? But if we do, we move them from their families. And so we are continually in ethical debates, in struggles to balance between acute care and those demands that are put upon the acute care system by the challenges in other parts of the system. So we work with our partners. They all do their best to help. But unfortunately, it can backfire on families, and we do try our very best not to make that happen, but sometimes it does.
Yes. And you raised the point about ethical decision making. I think throughout this whole pandemic, there have been those key decisions and ethical decisions about a variety of things: who gets surgery, who doesn't get surgery, where do you get the treatment. And it just doesn't end. It just changes sometimes depending on the pressures. You raised the other point about it isn't just hospitals, it is a healthcare system. And what happens if one part of a system impacts the other. And that's important as we move forward to help to work towards solutions for the future, considering it as a system for sure. Now, the 20-bed increase throughout the sites that you mentioned, are you anticipating that may stay to help cope after COVID when you have to deal with the pressures of the surgeries that have been delayed? Or is that a political question? Sorry.
No, it's a very good question. We have always advocated that given the amount of occupancy, Ontario has the fewest acute care beds per capita of most of the First Nations, the nations of the world. And we've always advocated that, for us to be able to surge or maneuver in a way to adapt ourselves to the needs of the community, we should have some buffer. When these beds were proposed, I put my hand up right away and said yes. And the hope was that, look, we can show we can do this and use them appropriately. And then hopefully we can advocate, and we are advocating. We've been told they'll be supported for the 22-23 year, again, another year of them. And it's my hope, and I have asked and advocated for, and even as early as this morning with the Minister of Finance, advocated for those 20 beds to continue into the future, because you're exactly right. When I try to deal now with my staff on the backup of surgery, I'm still going to have a wave of people post-pandemic. In the Spanish flu, they had the pandemic and people thought it was over because the deaths were ending. But post to that, there was this influx of patients that flooded the system for 2 or 3 years. The same will happen here, and it is happening. And so we need those 20 beds, and we're advocating to maintain them going forward.
So one of the other movements in rural Ontario has been around migration, where those from the urban centers are, transferring. Impact do you think that might have, or have you seen any impact on those people who have come to get away from the urban centers to reduce, obviously, the risk factors and are working from home?
Yeah, we have, and in a couple of ways. We've seen people show up from other areas trying to escape and turning up in our emerges positive with COVID. and the reality of, where you're thinking you weren't going to spread it when you came up here. And it was like, well, they try to make a personal choice. It's not our role to decide what people should do. That's a public health concern. We treat whoever walks through the door. But yes, we've seen our fair influx of people come who've tried to escape from the city. And unfortunately, in some cases where they've come up to think to isolate, but think skiing is isolating, which it isn't. and so, yes, we've had to kind of do some education on that front. So yes, we've certainly, on the positive, we've seen an influx of physicians who are interested in coming to the region and now being with their families where they feel safer, where they feel there's less pressure, and certainly we have that environment. So we're welcoming that side of what's coming from this and taking that as a positive.
So a little bit of a positive to a gray cloud, for sure.
Yeah.
Did Grey Bruce Health Services accept patients from other provinces?
Yes, absolutely. In wave 3,
okay.
And in wave 3, we did take them. In wave 4, we have not had to do that, but we have taken patients from out of region during wave 4.
Okay. And that's just because there just is no other bed availability elsewhere.
Well, yes, and because, particularly we are a specialty site. So because we are a level 3 ICU site, we're capable of taking the more complex patients. So there's limited ICU beds in the province, and you want to kind of spread the load out so no one hospital is taking all the burden. And in wave 4, the Southwest has been a hot region. So we are still the hottest region right now in the number of COVID cases. So we are in the north part, so we're not as heavily impacted, though you just heard me say, this is the most I've seen so far. But we are part of that leveling plan where if we have to move them, we received quite a few from Royal Vic out of Barrie. We've received a few out of Toronto and some of the South. So we have been all part of that engagement.
Yeah, and that's the larger system when you think about it, region to region and certainly out of province. And it's important to recognize that even though we're rural Ontario, we have an important role to play for other provinces as well. So you mentioned earlier in the conversation that there are high occupancies for mental health, for example, and medical. Can you speak to, is that a direct result of the pressures from COVID? So it's not COVID admissions, but it's, I'm not sure what the term is for that when others are, do you have a term for that?
Yeah. It was predicted when we started in the pandemic that a couple of things that would occur from this long term would be because of the shutdowns, which the system had never really experienced, that we would expect to see from a medical perspective, people who would come after the system much more complicated and much sicker. That is what we're seeing. So what we're seeing from the medicine side is when patients are coming in, they're already sicker because they've waited longer. That means once they're in the hospital, they're longer in the hospital before they come out, which is putting pressure on the system because we're not turning the patients over. We were also told at the start to expect that mental health issues will climb. When you isolate people, when you cut off their resources of support, their ability to communicate and congregate becomes more difficult, then mental health will start to escalate. And we have seen that for 9 months.
Wow.
It's never ended in the 9 months. In fact, I would argue of all the pieces that have been pressured, mental health has the highest pressure for the longest time. And even though we focus on ICU because of deaths, the indirect damage from mental health is huge. Addictions, suicides, etc. All of that will be a pressure going forward for the next 2 years.
And you raised the point that it will take several years to get past the immediate part of COVID. And that certainly is evident as we're seeing more and more people struggling and looking for help, for sure. Mental health care is provided just in the Owen Sound site, or is it offered in the other sites as well? Because you are a regional center.
Yeah, so mental health, the Form 1 part, the part where it's high intensity, is just in Owen Sound. But the majority of mental health services are actually spread across the region, and they're delivered, of course, by Grey Goose Health Services, but also in partnership with CMHA and other services, the paramedic services most recently, and public health, all participated in some congregate setting help. There was an active team that went in when through the earlier waves where we saw a real pressure on Saugeen Shores. We worked closely with the Indigenous community to put together an active team that acted very quickly and very supportively, and that's worked really well. And most recently, just got some funding to support it to try to keep it going. So there's been a lot of activity, but it is absolutely across the region. And mental health is not restricted to mental health patients. And so people need to be aware, the amount of depression and loneliness, isolation for seniors, who are the majority of people we see, is huge. The fact that, everyday people feel it with their families and not being able to see their families. And we see it a little bit in interactions, even on day-to-day interactions, where people are not as patient or not as forgiving or as understanding, and they're quicker to anger. And so we're seeing more of that. And hopefully that'll dissipate as the restrictions that are in communities come off and people become more understanding. The vast majority of people are wonderful. They are supportive. They are kind. They are very Canadian. But we are seeing a higher level of agitation and sadness and depression, even in the what you would call mental health patients. So.
And certainly you can see that even out and about in the community, where the fuses are a little shorter. People are just a little bit quicker, and that's unfortunate. We haven't touched on equipment or, how the community can support you. And I want to make sure we cover all the areas that you need covered. So the foundation supplies capital equipment needs in addition. How can the community help you? Because I'm sure with the volume, you need more of, whether it's PPE or big ticket items.
Yeah, so I will tell you, from a PPE front, we're actually doing very well now. And that was very important on the early days, but now we've stabilized the supply chain. But I want to say, probably one of the greatest things that's come out of this, and a thank you to the communities, because our foundations, who do remarkable work and have supported us wholeheartedly, entered this going into the pandemic thinking, okay, we can't do all the things that we do every year. How possibly are we going to be able? In fact, they sat down with me and clearly said, look, we're not going to be able to meet our commitment. Well, in fact, they've surpassed everything they've done in previous years.
Wow.
And the reason why is because communities have just realized how important healthcare is, and they've come forward to support the foundations. And the foundations have such good, strong names, and they're advocates out there all the time. And I think people have responded, and some extremely generous donations have come forward lately, and not small ones, a couple of $1 million ones. So wow. It's remarkable, and the foundation will take $5 or $5 million. They're happy either way. But I will tell you, it is the kindness of people thinking about the hard work that goes on every day in the healthcare system. And when we receive these donations, they're a thank you to the staff. They're a thank you to the community. And it's often people reinvesting back into the community when they say, look, my husband was sick, my wife was sick, and this is what you did for me when my family. And some people have not been in the healthcare system up here for 30 years and still have come back and said, you know, when my children were young, A, B, and C happened and you saved their lives. You know, I at the end of my life, I want to give you A, B, and C dollars to show you how much I appreciate it. So actually, Carol, it's a tremendously heartening thing that's occurred. And I'm taken back there was $1 million donation last week from the Peninsula, from a community group who, there were tears when they donated, their tears when they donated. You know, our gratefulness and their tears. And I will tell you, it means so much to everybody. So it's a great piece of this.
And we would certainly encourage the community to continue to donate and contribute, because it's such a wonderful, I mean, it gives me goosebumps to hear you say that you surpassed, but the need is there, and for sure. I know we only have a few more minutes left. Virtual care, 2 minutes. Are we? Is that going to be part of our healthcare system in the future?
Code white.
Apologize.
That's all right. You're in the hospital. We get it.
The answer to your question is, yeah, it absolutely is. We've certainly seen it grow. We've probably had a 200% fold of virtual care across our region and across the province, quite frankly. And I think, you know, our new virtual Emerge pilot is supposed to happen in March. That'll be one of the first pieces that will come out. The doctors now are recognizing, the majority are recognizing that there's a large part of what they can do virtually now, and intend to keep that into the future because it works. They still need face-to-faces. They still need to touch base and see people, obviously. But there's a portion of what they can do that they don't need to do anymore face-to-face. And that's better for the patient if they can do it from home. And it's a better way of providing care. It's more efficient. So I think it's here to stay, whether we think it is or not. I think it is here to stay.
So again, some changes that could be potentially positive out of COVID, that a new model of healthcare may be brought to our area. Gary, the time always flies by when I chat to you. I want to thank you for the time that you've given us. And you are always welcome on the show. I'm hoping the next time we don't have to focus just on COVID and can talk about other things. But thank you for your time. And thank you to the viewing audience for joining us today. And please join us again to learn more about services and resources available to you and to your family. Take care and stay safe. Thank you.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
What kind of show do you want to see on Rogers TV? What interests you? Log on to rogerstv.com, fill out a show proposal, and tell us about your segment idea. We want to know what you want to see. Rogers TV, only on Rogers.
I'm Wendell Clark with a word about winning. We all know it takes a team effort in any sport and with any challenge. You can be a part of the winning team that shuts